Well, our top story, the latest on the vaccine news in India, and the Prime Minister chaired an all-party meeting on the coronavirus situation. In his address, he said that experts believe we don't have to wait too long for a vaccine, maybe in the next few weeks. And he said as soon as the scientists give a green signal, vaccinations will start in India. He also said frontline healthcare workers, elderly people and those suffering life-threatening symptoms and diseases will be among the first to get the COVID vaccine. He said teams of the central and state governments are working together for vaccine distribution and that the costs are also being worked out, keeping public health in mind.
करीब 8 ऐसी संभावित वैक्सीन है जो ट्रायल के अलग अलग चरण में और जिनकी मैन्युफैक्चरिंग भारत में ही होनी है। जैसा यहां चर्चा में भी बात आई, भारत की अपनी 3 अलग अलग वैक्सीन का ट्रायल अलग अलग चरणों में है। एक्सपर्ट्स ये मानकर चल रहे हैं कि अब कोरोना की वैक्सीन के लिए बहुत ज्यादा इंतजार नहीं करना पड़ेगा। माना जा रहा है कि अगले कुछ हफ्तों में कोरोना की वैक्सीन तैयार हो जाएगी। जैसे ही वैज्ञानिकों की हरी झंडी मिलेगी, भारत में टीकाकरण अभियान शुरू कर दिया जाएगा। टीकाकरण के पहले चरण में किसे वैक्सीन लगेगी, इसे लेकर भी केंद्र सरकार राज्य सरकारों से मिले सुझावों के आधार पर काम कर रही है। इसमें प्राथमिकता कोरोना के मरीजों के इलाज में जुटे हेल्थ केयर वर्कर्स, फ्रंटलाइन वर्कर्स और जो पहले से गंभीर बीमारियों से जूझ रहे हैं, वैसे बुजुर्ग लोगों को दी जाएगी।
All right, so the Prime Minister, they're talking about the vaccine, the program that is being worked out with state governments in terms of the cost and who gets priority. And the big news there that in a few weeks, he expects the experts will give a nod to a vaccine. He says 8 vaccines are currently in India and 3 are in the later stages of testing. So with the vaccine now in sight, the next challenge for India lies in creating a successful immunization program. Now, there is a national expert group on vaccine administration for COVID, which was set up by the government to devise the immunization program, which is to build on end-to-end supply chain and logistic systems. The role of the supply chain is to ensure effective vaccine storage, handling and stock management, rigorous temperature control in the cold chain and maintenance of adequate logistics, management information systems as these vaccine vials will go across the country so that the inoculation can take place. But that infrastructure that we currently have in India has been geared to immunize children and pregnant women. Many experts have pointed out it's not adequate to vaccinate India's 1.3 billion people or even the critical mass which will be vaccinated. So the capabilities have to be significantly scaled up is what most experts have said. Well, to talk more about this challenge, we're now joined by Mayur Shetty, CEO and Product Architect, Black Frog Technologies Private Limited, and Dr. G.C. Khilnani, Chairman, PSRI, Institute of Pulmonary and Critical Care. Thank you so much both for joining us. And first to you, Dr. Khilnani, some good news in the sense the Prime Minister has said that he expects that perhaps over the next few weeks, the experts will give a go-ahead to a vaccine in India.
Yeah, that's actually a matter of pride for the country that indigenously made vaccine by Bharat Serum and ICMR, namely National Institute of Virology, has been able to make a vaccine which is in phase 3 trial, and 25 centers are conducting a phase 3 trial. That is, thousands of volunteers are being given vaccine, and followed by which they will be tested whether the antibodies are formed in their blood, and then the scientists will go ahead that this vaccine is being effective. Besides this, of course, several companies, including the Pfizer and the Astra, as we all know, have already prepared vaccine, and United Kingdom has given already go ahead, and FDA of USA excuse me, is in the process of giving a nod. So now this is a very, very good news for world as well as India, and we are proud of that. But we need to understand what will vaccine do. At best, the co-vaccine which is being tried, which is at the phase 3 trial, is actually has a success rate of 60%, 50 to 60% as it is called. Secondly, everybody agrees that it will take probably more than a year to immunize all the population. What we are looking at is herd immunity, and herd immunity is achieved by infections, which has already occurred in certain percentage of cases, and in the
Yes.
world 10% people are immune. Now, vaccine and the infection combined, if we are able to achieve 60 to 70% of people who are immune to the disease, then the transmission slows down and stops. We are not expecting in everything in first 3 months of 2021. I want to tell you through you, it is going to take months and years to achieve this goal. So vaccine is absolutely essential, and the world has eradicated smallpox and to some extent polio by vaccination. But as far as corona is concerned, the vaccine will be able to slow down the transmission, and it will take months and years to achieve eradication. That's what my take. Thank you.
Right. So for a long time yet, we still have to continue with our mask wearing and social distancing.
Yes.
But the focus now goes into, the logistics of getting the vaccine across the country. Mayur Shetty, if you could talk a bit about that. Your startup is something that helps in, that last mile connectivity for vaccines and refrigeration. So this is something that's very important. It's also a huge logistical challenge now for the government to ensure these vaccines get safely to the various states, and then from there on they're distributed further.
Yeah. Hi, Gargi. Thank you for having me over. I'm going to focus specifically on the transport and the last mile delivery aspects of immunization, because that's what presents the highest risk of thermal degradation. More specifically on the Pfizer vaccine, which is going to be deployed very soon. While they claim they require about minus 70 degrees Celsius storage temperature, there is a little bit of a silver lining there, which is that up to 5 days, up to 5 days prior to administering the vaccine, it is thermostable at 2 to 8 degrees Celsius. And that's where we come in. BIRAC under the government of India had supported us. They've been benevolent since 2017. So that's when they addressed this problem of vaccine cold chain. And in a manner of speaking, we've been conducting R&D on our cold chain system far longer than the development of the vaccine in itself. So now we're ready. We are at the front lines. We're just waiting for the green signal from Ministry of Health and Family Welfare to deploy our system so that we can deliver efficacious vaccines to the farthest corners of the country.
All right. And Dr. Khilani, if you could also, talk about this issue of the challenge that India now faces in getting this vaccine to various parts of the country. We're still waiting to find out which vaccine will get first. We know in the UK they're getting the Pfizer vaccine, but that's not something that we're going to see here just yet. Possibly it's going to be either the Oxford vaccine, the AstraZeneca one, or one of the indigenous vaccines. But even then, a refrigeration system, a cold chain system, storage, etc., is needed for that. So, that is another challenge to look at once the vaccine is in place, isn't it?
Yeah, that's right. Gargi, the thing is that I'm not very enthusiastic about Pfizer vaccine because of the problem of storage. They need 70 to 96 degree minus, and that those very few are available in research labs even in India. As far as the Astra vaccine is concerned, the efficacy is anything more than 70%. And also their capability of producing, as they claim, as we know, is amazing. They think that they have claimed that in next year's time they'll be able to produce 1 billion vaccine, and this is pretty stable. And I'm looking at it that Astra vaccine could be useful for our country. As far as the indigenous vaccine is concerned, and we must tell through you that India has been probably the largest producer of vaccines, not only probably the COVID, but the other vaccines also. So our country has an amazing capability of producing mass vaccination. So I am very enthusiastic about the indigenous vaccine, that is Covaxin, which is actually at a very advanced stage and with good efficiency and good safety profile. And I think that will see a light of the day soon enough. But at the cost of repetition, I would say our type of life, the quality of life will definitely improve with the vaccine. But nobody should go with the idea that in 3 months' time you will have pre-pandemic freedom of movement without a
Sure.
mask and without social distancing. That will have to continue for quite some time now. Thank you.
Right. And Mayur Shetty, again, even if, it's not the Pfizer vaccine that we're not expecting in India anytime soon, but even the other vaccines do require refrigeration, and therefore this entire, cold chain infrastructure is very, very important. And that's something that many experts have been a bit worried about because, to get these vaccines safely to the people who need to be, inoculated.
Yeah, certainly. Cold chain is the most crucial part once the vaccines are approved and are being deployed. And this is certainly not something we can take for granted. There's two sides to this particular issue. One is the economic burden of wasted vaccines. Early estimates show that India loses close to $7.5 million every single year due to use of non-compliant and inefficient systems such as ice boxes or frozen gel packs for delivery of vaccines. The second aspect is the risk of administering inefficacious vaccines. I mean, the scientific community has been working so hard developing these vaccines in such a short period of time, and now it's an engineering challenge to deliver the vaccines in the right and appropriate conditions. So it's not just you and I, everybody from the armed forces to the parliamentarians are going to be receiving in non-compliant devices if we don't take cold chain very seriously. And this means that you could receive a vaccine that lost its potency on the way to you. And that's almost a nightmare scenario because you are going to get a shot and you're going to assume you're immunized and you're going to go about leading your life as if you're protected against a disease. I think that's very, very, very dangerous.
Right, an important point there. And I like that point about, from the scientists, now it's up to engineering to, ensure that these cold chain process and that, the logistics work out so we can get these vaccines safely to everybody. Thank you so much, Dr. Khilani and Mayur Shetty for speaking to us on the show.
Thank you.